Thank you. Okay. Yes, thank you. Just come to sort of showcase something that I've been building the last few months. It comes in my role. I'm a GP. I'm a clinical director of a PCN, and also a digital lead with the ICB in Western North London now, well, at least for a few more weeks. As a CD, I was struggling with the amount of data sources that are out there. I think it's probably a struggle a lot of you share, that we've got so much data that we have access to in quite a fragmented way. There's our own spreadsheets and searches that we run internally. There's the NHS digital data. There's public health data, CVD Prevent, workforce data. And, it wasn't easy to try and put it all together and have easy access to it, and actually to try and get useful information and insights from it to kind of drive what we were going to do next. So where it's really accelerated, I've got a basic sort of experience with coding and making websites, but since I discovered Claude and ChatGPT in April, it's kind of been turbo boosted. So it all started with trying to get some of all these data sets in one place. So I started having a look at the NHS digital data, extracting the data and getting the AI to start to build dashboards for me. And the first version of it wasn't very good. It required a lot of iteration. And I think one of the most powerful things is as a clinician, knowing how I want the data presented and what would be useful for me. And after the first version it gives you, it thinks it's amazing, but then you tell the AI, actually, that's not very good, and this is the way I want it. And then about 100 versions later, you get to these are some of the screenshots of some of the dashboards I've been building. So it brings together sort of the PCN, DES funding and R's planning, telephony, access analytics, online consultation data. This is all from the NHS publicly available information, GPAD, NHS app, QoF, CVD Prevent. There is so much, but what I realised is that I could start using the AI to try and help triangulate it all together, and to get to build to give it to you some insights from it, and the things that are because I'm on the front line, and as a clinician I knew what questions I want answered. So what I tried to get it to present the data in the way that's most operationally useful. And with the AI and the speed at which you can iterate things is absolutely amazing. And so from that, for example, like trying to triangulate all the data together with online consultation, telephony, and GPAD data all in one place, and then using it to try and forecast future demand and capacity is one example. Another cool tool I built is putting all of this data together in one dashboard, and you can actually query it with natural language, and it builds the queries to query the database from there. So you can basically ask it any question, and it can pull all of this together and give you an interpretation of that information in a way that's actionably useful. So it's got loads of potential, and wanted to bring this here today to try and inspire more. Because you actually don't need any coding knowledge to do this. You can use the AI to build tools that are useful to you on the front line, and really iterate it to make it something useful for your own team. So a lot of these dashboards are the ones that are more national data, but the ones that I built internally for our own PCN and our own federation are even more useful and customizable to how you exactly want to do things on the ground. So the kind of takeaway is that, as a lot of people were saying this morning, is that we're quite data rich but knowledge poor, and I'm trying to help bridge that gap with this, so that we can get better signals and operational information to help drive the decisions that we're making in our organizations. Thank you.